Today I'll be telling a poem by Catherine Marple called To Love a Diabetic. To love a diabetic is to be a doctor. It means helping her to remember her medications. It means driving her for an hour to the only 24-hour pharmacy when she's gotten the flu and can't take the NyQuil that's in the refrigerator. Or driving her to the hospital when the simple flu turns into bronchitis and her blood turns acidic. To love a diabetic is to be patient. It means knowing that some days she won't feel good for no visible reason. It means canceling long-term plans when suddenly she doesn't feel well enough to go on the trip. Or waiting to go to bed while she injects her bedtime insulin. To love a diabetic is to be a priest. It means consoling her when she's tired and feels like she can't do it anymore. It means listening and not passing judgment while she tries to figure out her new dosages and makes mistakes. Or during those tough times, listening to her burial wishes just in case. To love a diabetic is to not be superficial. It means seeing her bruises and beauty marks. It means caressing her scars across her stomach or kissing her dry lips while she's hooked up on IVs. To love a diabetic is to be selfless. It means going to restaurants based off carbohydrates and not the atmosphere. It means going without dinner when money is tight because you can buy her medication instead. Or testing your blood sugar on her new meter to make sure it's working properly though you're terrified of needles. To love a diabetic is to be brave. It means keeping your chin up while she talks about those scary moments. It means not allowing her medical mistakes to color your relationship with her emotionally. Or keeping positive spirits even though all of the websites and gatherings tell you she won't statistically make it past her 40s. To love a diabetic is not easy. It means putting her medical needs before any other finances. It means worrying every moment that she is properly cared for, even when you can't see her. And it means trusting her life in the hands of so many doctors who don't understand the full complexities of the disease. Thank you for loving a diabetic.